Partnering and building good relationships and rapport with the parents of the children and adolescents in our programs is really the foundation of building a therapeutic and conducive treatment relationship for our families. It's not only important that we have open communication and positive relationships, but also that we can establish really a deeper sense of kind of intimate and profound trust with the parents, which we can demonstrate not only in our clinical competencies, but also the way in which we communicate, which provides better care all around. PreciouStatus has allowed us to, I think, gain a deeper level of commitment and fulfillment to our families. It's been very satisfying for our staff, the organization, myself, the administrative team, to know that we have this deeper connection with the parents and that we're doing something innovative and cutting edge.
I love special education because the kids, they're so pure and honest. I love making a difference and being able to change their lives. So last spring, I heard about PreciouStatus. It was something different than writing in students' notebooks every day, which is incredibly time-consuming. And I began trialing it for our school, and I have fallen in love with it.
The population of children that I work with, many of them are nonverbal or have limited speaking abilities, so their ability to go home and say, "Mom, Dad, guess what I did at school today?" is so limited. What really appealed to me about PreciouStatus was that it dealt in real time, that I could get messages to parents immediately instead of waiting till the end of the day and having to follow up at a later time. And the family can know, what happened and engage their kiddos in conversation or validate that happened to them today.
Something I can do as the day goes along. So it's up to the minute. I can tell a parent that we are doing morning meeting right when we're doing morning meeting. I can take a picture and send it to the parent of a student writing their name for the very first time, which I did do last year. And it saves me time because instead of writing in notebooks at the end of the day, it takes 3 to 5 minutes for each notebook, and for 5 kids, that's 15, 20, 25 minutes of handwriting in notebooks that I don't have to do.
PreciouStatus is really easy to use. So you can update and tell all of their parents at once, but it's only telling them their kid. It's easy for the provider to be able to do 10 patients at once instead of having to go through it individually.
This is such a wonderful tool for our families and for our teachers to be able to use with our students. It allows them to have communication with our parents and to allow them to connect in a way that they haven't been able to connect before.
The relationship between the therapist and the patient's family is a critical one. If you don't have parent buy-in, you have much less of a chance to make a difference in that child's life. And PreciouStatus has allowed us, looking from the business lens, it's allowed us to be differentiated in the way that we interact or communicate with the families. It's an added layer, which I think is helpful. It gives them a sense of, okay, these people know what they're doing.
For our teachers, this is something that's been a real useful tool. It's cut down on the amount of paperwork, and they're able to really have communication with the parents.
And PreciouStatus has been an awesome bridge to really just being able to see their child in moments that they might not have ever seen them is such a gift. And it also just helps them know, this is what we do here. They can see that their child's in programming and in process groups, they're doing rec therapy or in school, and it just helps them feel more connected, more safe about what we're doing here, and more involved.
The parents, it's an opportunity for them to kind of live the student's day minute by minute as they're going along. This way the parents get more information as it happens, and they're much more a part of the students' lives. It has an impact on not only the student's life, but the family's life as well.